So we're talking about goniometric measurements. The three devices here in front of me are the ones that are going to be necessary to measure the thumb. This is an option for the fingers. I don't use it a lot, but wanted to share it. And then this is another device, the one that I technically commonly use for measuring the digits. What's nice about this one is if you were measuring someone who had limitations maybe with opposition and you wanted to measure from pulp to pulp, this one does have a ruler attached to it. But that's for another time. I will put this one aside, but just wanted to bring it to your attention. So essentially you're going to be using one goniometer that you are very familiar with, the half moon. We will use this one in only one of our measurements, and that will be for the CMC joint measurement of the thumb. And then of course this is another half moon goniometer. This is your fulcrum on this particular device. And I don't really say, even though you have a movable and a stationary arm on this goniometer, it's technically designed as which arm is proximal to the body versus when the arm is distal to the body. So in most cases you can have a stationary and a movable, or a proximal and a distal. All right, so we're going to get measuring on our digits in our thumb. Okay, we're going to start with measuring thumb range of motion, and there are three joints that we're concerned with the thumb. The CMC joint, which is almost invisible, but you can actually tell when it's moved, so you can find the joint. We'll measure the MP joint and the IP joint. So we find the fulcrum, which is going to be right at the CMC joint. We leave the stationary arm with the radial side of the nail, and the movable arm will be measured with the ulnar side of the nail of the thumb. So I'll ask the patient to bring his thumb out, and in this particular case I am getting him at roughly 50 degrees of range of motion. So I just want to make sure that my stationary arm is where it needs to be, my movable arm is where it needs to be, and my fulcrum is in place, and he's got just a little bit more here. So that's at 50 degrees. Okay, and now we're going to switch to one that's a little bit different to measure the MP and the IP joint. So the first thing we're going to do while he's in this position is to see whether or not he's zeroing out. And I'm going to say this is 5, but there's a gap here. So I'm going to actually turn this so that I can get a more flush, putting the fulcrum on the dorsum of the thumb MP. He's starting at 0, and then here he's got approximately plus 10, and I can kind of tell that if I measure on this side. So you're looking at about 10 degrees there of hyperextension, and I'm measuring it on this side because sometimes it's hard to get the area that you want. And again, you can see it here on this side on him. But if you had someone who had like maybe 25 degrees, it might be a little bit more difficult to get that. Now I'm going to ask the patient to turn his hand this way, and I'm going to ask him to take the tip of his thumb and touch the distal palmar crease. So bring your thumb down like this. And then I measure here, and he has 60 degrees. That's at the MP, so 0 to 60. I ask him to relax this position and bend just the tip, and he is getting to 60 degrees. And I'll turn it slightly so that you can see the number there at 60. And that takes care of the thumb. So now what we're going to do in the same position, and I'll turn his hand like this, and what you will notice is for this particular endeavor, in order to get a composite fist, we must measure 12 measurements, 1, 2, 3, on 4 digits. So I'm going to ask him to make the best possible fist he can make. I know from my inspection, and I'll show you very quickly, if he puts his hand flat, and if he lifts his fingers up completely, he has hyperextension, and he has no deficit for extension. So we can already assume that this particular patient is at 0 for all those points. So I'm going to actually have him to turn and make the best fist he can. And most of his issue is at his thumb. So I anticipate there'll be some deficit. His index finger is at 70 degrees starting at 0. And again, we have the proximal end of the goniometer over. Okay, so the MP, and remember for all 4 digits, the index, the middle, the ring, and the small finger, you're going to have your proximal end lined up on the dorsum of your metacarpal and your distal end of the goniometer for the metacarpals at the P1 or the proximal phalanx. So with this particular digit at the MCP, we're getting to 70 degrees. And then over here on the middle finger, he has about 80 degrees. Okay, and so you can see the 80 degrees there. And then on his ring finger and his small finger, he's actually getting full 90. Good, right there. And then 90 here as well. Okay, so that takes care of our metacarpals. And if you're recording this, his index was 0.70, middle finger was 0.80, ring finger was 0.90, small finger 0.90. So now we're going to move to the PIP joints. And as stated, he can get to 0. So there's your 0. And then here he's getting to 50. And remember the fulcrum is right over the dorsum of the PIP joint. And there's your measurement there. And then we're going to move over to the ring finger. And here he actually has 80 degrees. And there's your 80. Again, the proximal end of the goniometer is on the P1. And the distal end is on the P2 or the middle phalanx. And I'm going to turn it this time only because he has on the wedding band so that I'm not affected by the goniometer lifting up. And on this particular measurement, he has, without my help, 80 degrees. And then on the small finger, he has also 80 degrees. Okay, there we go, right there. All right, so now we're going to actually move to the distal interphalangeal joint. And on the when we measure the distal interphalangeal joint, the fulcrum will be over the distal DIP. The proximal arm will be over the P2 or the middle phalanx. The distal arm over the distal phalanx. So here he has, let's see, we recorded earlier 30 degrees. Let's see if we can make sure that you guys can see this. Okay, so there's the 30 degrees of DIP, and that's what that looks like. And again, I've flipped it over, and sometimes you'll have to use, your creativity with which end should be your proximal end or which end should be your distal end. And then we have 50 degrees at the middle finger, so from 0 to 50. So there's your 0. And then down to 50. And then here, ring finger is at, let's see here, looks like it's able to get, let's see here, let's make sure that the fist is still composite. And that may be a little bit tricky when you have somebody with an injury. As much as you can though, try to get those fingers moving together. But that's going to give us 60, and then over here on the little finger, seems like he's getting a little bit more and getting out to 70. All right, so those are the numbers for his composite fist. Okay, now we're going to talk about how to calculate the total active motion for a composite fist. And what I have up here for you, we talked about the 3 joints. You have your metacarpal phalangeal joint, your proximal interphalangeal joint, your distal interphalangeal joint. And then along the side here, I've indicated your index finger, middle finger, ring finger, small finger. And what we did is we calculated these numbers first. We started at 0, so we wrote it or recorded it as 0 to 70 degrees. 0 to 80 degrees, 0 to 90 degrees, and 0 to 90 degrees. When we got over to the PIP joint, your index finger was 0 to 50, middle finger 0 to 80, ring finger 0 to 80, and small finger 0 to 80. We got to the distal interphalangeal joint, index finger 0 to 30, middle finger 0 to 50, ring finger 0 to 60, small finger 0 to 70. Now, in order to figure out the composite fist, there are some things that we have to do. We have to calculate the index finger, the middle finger, and the ring finger individually. So I have added up. Oh, and let me just back up. I have numbers here in parentheses. There's your 90. I told you during the measuring that the norm for the metacarpal phalangeal joint is 90 degrees. The proximal interphalangeal is 100 degrees, and then the distal interphalangeal joint is 70 degrees. If you add 90, 170, it's a total of 260 degrees. So you look at each of these digits individually. Your index finger was 70 plus 50 plus 30. That was 150 degrees. We divide that into 260. So that gives us 58% of norm for the index finger. We do the same thing for the middle, ring, and small finger. The tally here is 210. That's 80, 80, and 50. Ring finger, add 90, 80, 60, 230. Small finger, 90, 80, 70, 210. Now, when you do the computations, 210 divided by 260, 81%. 230 divided by 260 is 88%. 240 divided by 260 is 92%. Now, we know what each one of these digits are. We can derive from this, as we spoke before, is the index finger has the most disability. But in order to get a full composite fist, you now have to add 58 plus 81 plus 88 plus 92. That total is 319. We divide that by 1, 2, 3, 4 digits, divided by 4, and that is 80% of a composite fist. Now, that takes care of the 4 digits. The thumb, on the other hand, is just a little bit different. The CMC joint, the normative value is 70 degrees. The metacarpal, or the metacarpal phalangeal, or MP joint, is at 50 degrees as its norm. And then, of course, the IP is 80 degrees. And the total active motion, if you add these 3 digits up, is 200. So rather than dividing by 260 down here, you're going to divide by 200. Now, it's very important for me to say that when we measured our patient, he started at 0, he got to 50. He started at 0, he got to 60. The plus 10 actually zeroes out. Any hyperextension is not really included in your total active motion computation, but he got 60 degrees. So what I've done is I've written out here, so out of the 70, he gets credit for 50. Here, he actually had more than 50, but we cannot give him credit for the full 60. He only gets credit for the 50. And then over here, as I said, the plus 10 zeroes out. He gets credit for 60. If we do the math here, 50 plus 50 is 160. We divide that again, not by 260, but 200, because that's the total active motion for a normal thumb measurement. So 160 divided by 200 is 80% of normal thumb range of motion. All right, so that takes care of this portion of digit range of motion, computation for the thumb and a composite fist.